There are two effective medical therapies for hair loss. One is Rogaine, or minoxidil, and the other is Propecia, which is finasteride, the generic finasteride. Minoxidil is a medication that's been around a long time. It's used topically on the scalp, and it does induce hair growth, especially on the crown area. And nobody's quite sure how it works. We think it does stimulate blood flow in some way to the scalp in those areas, and it can reinvigorate the fine hairs that are there to make them more visually substantial. The other one is Propecia, or finasteride. It was a prostate medication that people found actually grew hair. And it helped us understand a little bit about how hormones affect hair loss. Everyone knows that testosterone is strongly associated with hair loss, but we found out that it's actually DHT, which is a breakdown product of testosterone, that is the thing that triggers hair loss very powerfully. So what Propecia does is it actually blocks the production of DHT, and so it lowers those levels in the scalp, and it prevents hair loss in that way. And hair loss is not something that happens in a day. It happens over time. And hair cycles every 3 years or so. When it grows back in those areas that are susceptible to hair loss, the hairs are finer. They don't grow out to full length. And it's those hairs that really are helped by both minoxidil and finasteride, or Propecia. Those hairs can be reversed. And if you look at the big numbers, it's a hugely studied drug. Propecia will prevent hair loss, further hair loss in about half the people that take it, and the other half will have that. Plus, they'll have normalization of the miniaturized hairs into normal, more optically substantial hair. So that's a great victory in itself.